Welcome to Conversations at the Well, a place where we have honest conversations about healing and restoration. Today, we're talking about something many people overlook: how our bodies hold stress, pain, and sometimes even trauma. Massage therapy is often seen as a luxury or a way to relax, but there is actually much more happening beneath the surface. Today, I'm joined by Tawana Reddick, who has been in the beauty and wellness industry for over 16 years and currently works as a licensed massage therapist. She specializes in trigger point therapy, relaxation massage, and myofascial therapy. And she is passionate about helping people understand how the body holds pain and trauma and how healing can begin through intentional care of the body. Tawana, thank you for joining me today.
Thank you for having me.
All right. To start off with, I would love for you just give us a little brief information about yourself.
As Tonda said, I am Tawana. I am currently a massage therapist. I've been practicing for about 16 years now. I currently practice in Charlotte, North Carolina. Originally from Greenville, North Carolina, but then I moved to Jacksonville, Florida for about 13 years. So I practice there. Well, more than 13 years, probably about 16, 17 years. But I practiced there for a while as well. I've worked in chiropractors offices, spas, wellness centers, et
Mhm.
cetera, et cetera.
I'm gonna tell y'all a fun fact about Tawana. She used to be my hairdresser.
Yes, yes, I started off as a cosmetologist, like she said. Yes, I did.
All right. So, what first led you into the beauty and wellness industry?
So beauty and wellness, like as far as like cosmetology or
Yes.
cosmetology, like let's see. I had an aunt that was a cosmetologist. She's a hairstylist. I think it runs in the family. I think it's in the blood. But I don't know. I just took an interest in hair, and I went to hair school while I was in high school. So I was finishing that by the time I graduated high school. So I did that for a while, and then you know got a little burnt out doing. You can get burnt out real easy with
Yeah.
doing hair. Yeah. Mm-hmm.
I can imagine. I can imagine.
Yep.
So when you were doing hair and you did the transition over to massage therapy, what was going on in your life at that time?
I started having problems with my shoulder. And so I went to see my doctor. He sent me to a physical therapist and then they recommended massage. So I went for a massage and it worked. And I was like, "Ooh, this was good." And I liked it. So I was like, "This might be something I'm interested in." And so I applied for the program, started the program, finished the program, and been doing it ever since. And I love it. It's a very rewarding career, just like hairstyling is as well.
Mhm.
But massage therapy, yeah, I love it. Hmm.
I think I remember when you went to school for massage therapy. Do you remember that?
Yes, yes,
Yeah.
yes, yes. I did back in 2010.
Yeah.
That's a long time ago. Wait, actually, I started in 2008 and I finished in 2010. So yeah. Yep.
I was oh wow, I'm losing my hairstylist.
Yep. Deuces. And I was like, I don't do hair at all anymore. Like, don't nobody
Right.
ask me, do your hair? My mama, my sisters, nope. Nope, I don't do hair. I give you a massage, but I'm not doing your hair. Yeah, once I stepped out of the hair industry, that was it. Like, I'm not doing that anymore. But cosmetology, I kept my license because I do facials. So I do still do the esthetician part of that. But as far as hair, nah.
Mhm. Okay.
No way. Yeah.
All right. What do most people misunderstand about massage therapy?
Most people think when they think of massage therapy, they think of pampering. I mean, which is a good thing, but it's more of a life. I mean, you need it as a lifestyle. Like you need it on a regular basis. Like you need it like you need exercise, because our bodies store so much tension from working at home or however you work, our posture. It's just an important thing. And I'm so glad now that more people are realizing that it's not just a pampering thing. it's like wellness. It's part of wellness programs now. So that's amazing to me. Mhm.
All right, you said you specialize in trigger point therapy and myofascial therapy. Can you explain what those are?
Yeah, so trigger point therapy is those knots that you feel. Like if you feel a knot in your shoulder or something, that's where I go in and put pressure there to kind of help release that knot. And sometimes I use a myofascia release. That is like using cupping. I don't know if you ever seen cupping, where that it leaves the mark, the circles. Michael Phelps, everybody know it from Michael Phelps. He had the red marks when he was doing swimming during the Olympics. But that helps to release fascia, which is what is wrapped around your muscle. And if it's too tight, that means you're not getting blood supply. Your blood flow is not flowing the way that it should. So those are my two favorite techniques, but I like to do them all. Yeah. Except for deep tissue, because some people you cannot get deep enough for. Like, no matter how hard you put your elbow in their back, you're like, oh, that's not deep enough. And it's usually little small petite women that want you
Uh-huh.
to break their backs. But yeah. Yeah.
So what have you noticed, like, when you're working on those trigger points and with the myofascial, have you noticed when clients actually feel that release in their backs or
Yes.
okay.
So yeah, I can actually feel the knot when it starts to release, and the client, the patient, they usually can feel it as well. And then with the cupping, that's gonna leave those marks. So you when you see that purplish circle, that means a stagnation. That area, that means a stagnation of blood flow. So that kind of help you know too that you're in the right area, when you're working that or cupping in that area. But yeah, definitely they get released when you do trigger point and myofascial. Yeah. Hmm.
So what are some physical issues that massage therapy can help with that people might not realize? Like, for instance, headaches. You did talk about posture issues, stress, chronic pain, injuries. So
Yeah,
how
all of those.
okay.
You hit them all on the nail on the head. Yeah, headaches, tension headaches,
Okay.
posture. I can always tell when people work from home. When I'm working on them, I'm like, once I start on their neck and shoulders and go to their lower back, I'm like, "Do you work from home?" And they're like, "Yeah." "How you know?" And I'm like, I can tell all of my people that work from home, they have the same issues. It's the neck, the shoulder, low back, neck, shoulder, low back. So that's your posture. And then just carrying like tension that you like held on to for years and years and years and years, that type of thing. Yeah,
Yeah.
definitely.
Yeah.
Hmm.
So how does it help with headaches?
Headaches, your migraines. It helps release muscles like your these muscles here in your forehead, your temple. Sometimes we use like cold therapy for people with sinus issues, sinus headaches. That helps. Lymphatic massage for the face. That's very helpful for headaches as well. A lot of people like the cold therapy though for headaches because that feels really good when it's relieving that tension for the head. Yeah, especially around the sinuses. Yep. Hmm.
Learning a lot today. I'm learning a lot.
Yeah, yes, good.
All right. So we talked about trauma being stored in the body. One of the things that you said you're passionate about is the idea that our bodies can store pain and trauma. So on this podcast, we talk about healing and spirituality. But like you said, healing can be physical and it can be emotional. How do you see the connection between physical healing and emotional or spiritual healing?
How do I see the connection? They're definitely connected. Physical, mental, like mind, body, soul is all connected. Um, an example, if you're laying on the table and I'm giving you a massage and I have to unclench your hands
Uh-huh.
to work on your fingers, you was holding trauma. Another one of my favorite ones is TMJ. That's when
Okay.
people grind their teeth.
Hmm.
And you're supposed to be so usually you do that when you're sleeping or maybe when you're typing. If you're grinding your teeth while you are supposed to be resting,
Hmm.
you're holding that's stored for me. And I'm not, I'm not a doctor. I
Hmm.
had about 5 semesters of nursing school. Like I didn't finish nursing school, but um yeah, you're holding that's trauma because you're resting, but your body's still in flight mode, and you're grinding your teeth, and so you're storing that in this joint here is the temporomandibular joint, um, and so when you contract that
Uh-huh.
on a consistent basis,
Mhm.
you start to get chronic tightness there, which goes all the way down to the neck, which goes all the way down to the shoulders. So usually when I touch somebody that has really rock hard muscles right there,
Mhm.
I usually be like, do you have TMJ? And they're
Uh-huh.
like, yeah, how do you know? And I'm like, yeah. I've been doing this long enough to know the muscles
Mhm.
that people hold that tension in to make those muscles tight. And it usually comes from a disorder called TMJ. That's
Oh,
trauma.
okay.
You're supposed to be resting, not grinding your teeth. And like I said, you're supposed to, if you're getting a massage, you're supposed to be relaxed. You're supposed to be breathing. If you're not breathing properly, that's trauma. You're supposed to be breathing. Somebody had to tell me that. Somebody had to tell me. I was getting a massage, and the
Mhm.
girl was like, "Breathe." And I lie not to you. I was holding my breath on the massage table. I'm like, "Oh my gosh, you're right. I need to breathe." Yeah, that's
I've
part.
gone through that too. I've gone through that too. Seems like I can't relax when I'm in the massage room.
Mhm,
It's
mhm.
so
I started off like that.
okay.
Now, girl, I'm knocked out sleep when I get a massage. As long as I know who you are, because like I said, you don't want just anybody touching on you. You want to know your massage therapist. That's important because, like you said, mind, body, and spirit, and then you want to know who's touching you because stuff transfer. But I now if I know I usually know my massage therapist. I'm knocked out. Like I'm breathing, snoring, slobbering. Yeah. Uh-huh.
You touched on something right there that I want to expand on.
Okay.
You said spirits transfer. Can you talk
Yeah.
because I know some people have the misconception about massage therapy that, if everybody that they would go see as a massage therapist, that they might be transferring their spirit on them. So talk to me about that.
That's touchy because you wanna know your massage therapist. I mean, I feel like you want somebody like-minded. So if you're a Christian, uh but I know we got a whole lot of new age Christians. And then when I say new age, I mean they're dabbling in crystals and all that
Mhm,
stuff.
mhm,
You just kinda wanna know, like, get to know your person. Because yeah, you can transfer. They can pray over you, like, they could
mhm,
be chanting over you, they can be doing spells over you. And you think you're just getting their, a regular hot stone massage, and they're doing like chakras on your back. Like you never know. So yeah, that's important. It's important that you know your massage therapist, and it's important for the massage therapist too to be guarded, like when you touching people, because sometimes you can touch people and kind of feel. I have touched somebody and I could feel like, ooh, like almost feel their trauma. Not to sound spooky or anything, but
mhm.
yeah, I could feel. So it's on both ends. We learned about the transference of, I ain't gonna say energy because that's new age, but the transference of when you touching somebody. So it's a serious thing. Hmm. Yes.
Something to think about.
Yeah, because we're more spiritual beings than we are fleshly beings,
Right.
So that's very important. Yep.
Have you ever had moments in your work where you realized your work was part of someone else's deeper healing journey?
Yes, I've had a couple of people start crying on the table, just having a release and cry, and then they're like, That's never happened. Like I don't even know I'm crying." I'm just like, just give them Kleenex, and I don't try to counsel them because I'm not a therapist. I'm just a massage therapist.
Right.
But yeah, some people do have release on the table. They have emotional release. I've had a few. One lady came in. She was like, "If I start crying," she said she had just lost her son or whatever. So she was saying if she started crying during the massage, just let her, you know, don't really say anything, just let me cry. I'm like, okay. But then I've had, a couple of people that just nothing like that, no trauma. They didn't say anything to me. They just start crying on the table. So yeah, you can definitely have a release through
So
massage.
what do you do when that happens?
Um, give them Kleenex, like I said. I don't. I'm not a therapist. I don't know what to say. I can pray to myself because you don't really. I don't got a permission to pray for the person. So, I mean, I just maybe when they leave, I'll pray, but I just keep I just keep working unless
Okay.
they tell me to stop. You know, can you stop the massage and just let me go? But I'll ask, do you need Kleenex or something? And then, just keep working. Because usually they'll get it together.
Yeah, get it together.
Yeah. Yep.
Okay. Alright. So let's talk a little bit more about you said you went into massage therapy after going to get your massage. So what was that massage like for you?
Well, that
When
massage was wonderful. I think it was Katrina who did it. Um, it was wonderful. She was amazing. It was a great experience. Very professional.
Mhm.
Gave me all of my time. It's supposed to be an hour massage. I got an hour. Yeah, really good massage.
I mean, it
Yeah.
had to be a lot to it for you to want to change your full
Yeah,
career.
and right, and then I felt the benefits of it
Okay,
afterwards.
okay,
Yeah, so
okay.
that was the main thing. I'm like, "Ooh, that worked." Because back then I was just thinking massage is pamper. People going to massage. It's my birthday. I'm going to get a massage. We hear that a lot, which is that's good. Still do that, but it's something that you need on a regular basis. I'm telling you, we all need it. I don't even get them like I should. But we all need them. You feel so much better in your body,
Mhm.
mind,
Okay.
and soul. Really, you do. You feel better. And the place that I work now is
Mhm,
a corporate building, but we are a wellness center inside of the building. So like all of the people that work in the corporate office have access to us. The wellness center consists of a doctor,
mhm.
two mental health therapists,
Okay.
a nurse practitioner, a physician's assistant, and a massage therapist. So like covering everything. And I'm like, y'all, and they get a good rates for
Mhm.
massage therapy. So I'm like, take advantage. Because a
Yeah.
lot of them work in financial,
Mhm.
like they do like numbers. So that's really stressful.
Yeah.
Yeah. Mm-hmm. So
So how often should you be getting a massage? What would be your recommendation?
depending on your income, your budget, um, if you can afford it, I would say bi-weekly. If you can't afford biweekly, I would say at least try to do it once a month. For the most part, massage is probably about the going rate is probably $80. So for an hour. Yeah. So yeah, at least monthly. If you can't do biweekly, at least monthly. Mm-hmm.
So is it
So
something that some insurance companies are covering now?
yes. Now, and that's another thing I'm so happy to see. A lot of insurance companies are starting to cover massage therapy. And if you are a veteran, um, there is a program called ZEAL, ZEEL, and they offer up to about 8 sessions complimentary from the VA. Yeah, and massage therapy. Yeah, I was doing massage for them as well. So they would send people to my office. They would send veterans to my office, and I would see them for um, their 8 sessions. Of course, you got to do paperwork, and I got to do notes and report it. But if you are a veteran, take advantage of it. That's a good program, a very good program. Again, that's ZEEL, SEAL. Yeah.
That's something that's something that I think will be beneficial because I have a lot of clients that are veterans, and
Mm-hmm.
they know that.
A lot of people don't know. That's a wonder, and it's kind of new.
Mhm,
So you can either go to somebody's office,
mhm.
or they have massage therapists that will go to your home. So I had the option to do either one, but I don't want to go to everybody's house.
Right.
I don't want to go to everybody's house. I said, look, can y'all send them to my office? They're like,
Mhm.
yeah. So yeah. They send them to your office. But yeah, nah, I'm not too going to do house calls unless I know you, you know.
Right, right.
But yeah, you do have that option. And so that I said that to say that massage therapy, people are realizing how important it is, not just for pampering, but like they sent me people there with one lady, like a lymphatic, she needed something with her legs, chronic back pain, anxiety,
Mhm.
all of those things. That's mental. I mean,
Yeah.
more than just physical. So,
Yeah.
yeah.
Yeah. Wow, this is great.
Mhm. Yep.
This is great.
Yeah.
All right, so do you have like, for someone that's listening who has never had a massage before, what would you want them to know?
Go get a massage. What you waiting for? Go and get a massage. I mean, like I said, your going rate for a massage is probably $80. I mean, put $20 aside here and there. Because we can go get our nails done, our toes done, and all that stuff done. But your body and your mind, and then like to keep you, if you want to live a long life and not have a whole lot of issues when you get older, go
Mhm.
ahead and start taking care of those things now. Don't wait till you get 1,000, a million sugar points. You know what I'm saying? And then try to work them all out when you 80. So, yeah, like go get a massage and then put it as part of your wellness programs. There are so many things out here now that help cover massage therapy, like the HSA. You can use that for
Okay.
massage.
Okay.
A lot of your check with your insurance, because a
Mhm.
lot of them cover massage now. Check with your job to see if they offer on-site massage. I've done that where I go to companies and do
Mhm.
chair massage for the employees. Um, so just check with your job because a lot of people are now incorporating it more and more and more. Like I said, from healthcare to corporations to veterans, like
Mhm.
that program with Zeal, which is a wonderful program. So yeah, it's a lot of opportunities out here for you to receive massage, and a lot of good massage therapists, you know?
You
But, I
made a
mean,
good
also
point.
be aware too, there are some crazies out here, but.
You made a good point though, where people go get their nails done, and I
Mm,
know they're spending that, what, every 2 weeks?
yes,
Yeah.
yes. Yeah,
Yeah.
and then, I mean, lashes and everything. I mean, you still look good,
Mhm.
but your body is important because I mean, that's gotta carry you through life.
Yeah. Yeah.
Your body has to carry you through life, and, I mean, the sooner you start taking care of it, the better off you're gonna be. So, yeah.
This is great. What are some signs that you might notice that I would notice in my body that would tell me that I need to go get a massage?
If you're having muscle spasms, headaches, back pain, shoulder hurting, you always got a crank in your neck, um, those type of things, yeah, go get a massage. Even if you're not feeling like you just mentally, you just
Mhm.
feeling anxiety, just
Mhm.
feeling like always jumpy, depressed. It helps. I'm telling you, a good massage helps with depression. It helps with anxiety. Yes. Yes, 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 yes. So, definitely, even if you're not feeling, like I said, aches and pains, mental. It's mental too. Like, if you're just feeling tired mentally, go and get a massage. S
So what would you say would happen if someone ignore those signs that they need to get a massage? What are
They're gonna
some
be one of those people I'm talking about that's gonna be 80 years old, about a million trigger points. Or you're about to run yourself crazy because, like, you can't sit still to get a massage. You know what I'm saying? Like, you can't take some time out to
Mhm.
just go lay on a table and let somebody help you release your tension and your pain, you know? Um, so it's like you're just gonna make those trigger points bigger, those knots bigger,
Mhm.
mentally just not feel good,
Mhm.
um, physically not feel good. Yeah. And then you'll end up seeing those things sometimes even in with like sickness like ulcers and stuff like that, ulcer colitis and things like that. Um when the body's the tension, like I said, I'm not a doctor or anything like that. But ulcers, most of the time that comes a lot from worryation and stress and all that stuff. Um, but yeah, just that pain, from things like that. That causes physical pain, like back pain and all those types of things. So everything is connected.
Yeah.
So you need to be getting a massage.
Yes.
Definitely. Yes.
So look, so for my therapy clients, I need to be referring them for massages, right?
Yes, definitely. Oh my gosh. That's why I said like that wellness center that I work for now, they're covering everything. They're coming from a doctor to
Mhm.
the physician's assistant to the mental health therapist to massage therapist. Yeah. That I feel like that's a real wellness center. 'Cause and a pharmacist, they got pharmacists in there too. So you got everything you need, you know? Take advantage, people. I'm like, why are you not taking advantage of this? This is crazy. For the most part, though, I do stay busy in there because, like I said, they're doing numbers that office, the corporate office, so they're always stressed. Everybody in there that comes with neck, shoulder issues mostly.
Okay.
Yep.
All right. If you could leave the listeners today with one message about caring for their bodies, what would it be?
I think I said 1,000 times.
Go get a massage.
Go get a massage because it's like I said, it's more than just a pampering thing. You need it for your mind, you need it for your body. So, you just need a good touch. Like you need those muscles released. Especially when you're carrying, like I said, trauma in your jaw or trauma in your shoulders or back pain. A lot of times that comes from like trauma. You just need some release and you don't want to wait until you old, to start trying to work all them knots out. I mean, you don't want to wait till you're old or you got all this pain that you getting all these back surgeries, neck surgeries and stuff like that. And could have like massage therapy can help with that. It definitely can. Cause like we get referrals now, like I said, more people are realizing like orthopedic surgeons and stuff, they're starting to refer patients over for massage. Yeah. Doctors. One of the veterans said that the doctor told her was the best thing for that lymphatic issue she was having with her legs was going to be massage therapy.
Okay.
That was going to be the best thing that was going to help her. So that's why she was coming to me. So it's the real deal, especially if you get a good one.
Did it help with those? They get 8 sessions. So did it help with 8? Did it help with just those 8 sessions, or did she need more sessions?
We saw improvement with those sessions, but of course she wanted to keep coming because like that's something you're just gonna have to keep going for, probably for a lifetime. But it definitely helped. Yep.
All right, before we close, where can listeners find you if they'd like to connect with you and learn more about your work?
Okay, so if you want, like right now, I closed my office because I had a lot going on at one point and I just didn't have the motivation to drive to do it anymore. But I do events. So right now, can I give a shout out to my event that I'm about to do?
Yes, you can.
Okay, so I'm about to do an event in Grimesland, North Carolina. Now this is more of the pamper event. It's called Facials and Frappuccinos. And so it'll be a group of ladies get together and we'll do hydrofacials, we'll do paraffin for the hands, we'll have food, we'll have games. It's gonna be great. So I do events like that. That's on April 25th. You can get a ticket on my social media handles are authentic_touch. And then Facebook it's just authentic touch. But yeah, right now I'm doing because I work at that corporate office, that wellness center. I work there Monday to Thursday. But I don't do my office anymore, but I will be hosting like more events like that. And so the next one will probably be more of like massage versus facial. But yeah, I do host events. So yeah.
All right. Thank you so much for sharing your insight. This has been great.
I enjoyed
I've
this. You have
learned
to
a
come back.
lot. I've learned a lot today.
Good. And we need to we'll have another time that we can do another
Yes, we will.
call. Yeah, this is really good. Thank you for having me.
All right, my closing reflection. Our bodies carry more than what we realize: stress, pain, experiences, and sometimes even trauma. But healing is possible. And sometimes healing begins with simply listening to what our body has been trying to tell us. And that is go get a massage.
Right, exactly.
Thank you for joining us today for Conversations at the Well.